Yes, sir. Myself, Dr. Mahesh Sachdeva. Telemedicine Rajasthan. It is the most important program at present. It is conducted on the ई संजीवनी एक ऐसा प्लेटफॉर्म है टेलीमेडिसिन सर्विस का जो भारत सरकार ने कोविड का आया उस समय लॉकडाउन लग गए उस समय इसको ई संजीवनी को शुरू किया गया। सबसे पहले एक प्लेटफॉर्म लाया गया ई संजीवनी ओपीडी करके, जिसमें एक आम जनता, एक आम नागरिक, एक आम रोगी सीधा डॉक्टर से संपर्क कर सकता था। ये मोबाइल ऐप एप्लीकेशन डाउनलोड करनी पड़ती थी। पहले एप्लीकेशन डाउनलोड करने के बाद उसके अंदर अपने आप को रजिस्टर करना पड़ता था पेशेंट को। पेशेंट रजिस्टर करने के बाद में पेशेंट रजिस्टर करता था अपने आप को। देन उसके बाद में पेशेंट रजिस्ट्रेशन के बाद में उसको टोकन मिलता, टोकन के बाद में उसको वेट करना पड़ता, फिर वो डॉक्टर से कंसल्ट कर लेता था। उसको एक प्रिस्क्रिप्शन जनरेट होता जिससे वो दवा ले सकता था, मेडिसिन ले सकता था। इसके बाद में धीरे धीरे जैसे लॉकडाउन खत्म होने लग रहा तो पेशेंट का इसकी तरफ रुझान थोड़ा कम होना शुरू हो गया और वह सीधा ही हॉस्पिटल में आकर के पेशेंट सीधा ही दिखाना शुरू कर दिया मरीज डॉक्टर्स को। लेकिन इसमें फिर भी गैप आ रहा था कि पेशेंट में एक डर था कि वो हॉस्पिटल जाएगा तो उसको कोविड होने की संभावना है। ये है तो इस स्थिति में यस सर, आवर कंसल्टेशन नेक्स्ट प्लीज Telemedicine e-Sanjeevani. Telemedicine is the delivery of the healthcare services where distance is a critical factor by all healthcare professionals using IT for diagnosis, treatment and prevention of the disease and injuries, research and evaluations, etc. All in the interest of the advancing the health of the individual and their communications. Objective of the e-Sanjeevani telemedicine is to provide specialized quality medical advice for rural patients, to monitor other medical staff about treatment procedures, to monitor and follow up on the patient conditions, to promote the proficiency of the specialist and the other healthcare persons by the means of the teleconsultation and the video conference based training, to reduce waiting time in specialized healthcare, follow-up visit in the surgery, etc. Next, please. There are two types of the module in the state. It is with the government of the India has launched the two initiatives under telemedicine to address the community need for primary health care. One is the e-Sanjeevani HWC. E-Sanjeevani HWC, which is the provide consulting service from lower facility to higher facility, means health worker to health worker, a doctor to doctor, medical officer to medical officer to specialist. And e-Sanjeevani HWC model is also called as hub and spoke model. It is a web-based application. Telemedicine service is designed on the hub and spoke model with spokes. HWC may be primary health care, primary health centers, sub health center to connected with the district hospitals, medical college for availing services. And second module is the e-Sanjeevani OPD. E-Sanjeevani OPD is the dedicated patient to the doctor's telemedicine consultation services. It is a mobile app based application. A mobile application need to be downloaded and one-time registration is required to avail free medical consultation. Registered patient can avail service for her family member as well. Health worker and other official, that is the school teachers. Next are the state intervention. Can facilitate the consultations for the citizen whenever needed. Next, please. State intervention. Establish the two state hub and district level hub at every district in 34 districts headquarters. Coordinate with the CDEC Mohali for backend support for registration of the medical officers, specialists, and the CHOs on these platforms. Training were held virtually in the multiple sessions. Capacity building of around 2,000 medical officers, 500 specialists, 70 super specialists, and district officials and district IT person in the coordination with the SHIFU. Capacity building of the district nodal officers and district technical support engineer for registration at the district levels. Training of 6,418 CHOs on telemedicine modules. Scale up the telemedicine service in the Chiranjeevi camps. Next, please. This is a roadmap of the HWC journey. In 2021, we only 48 consultations done. In 21 to 22, from 14 November 21, we organized Chiranjeevi camps in every panchayat headquarter. About 51,300 consultations done in 21 and 22. 2 hubs established in the state level, and 10 and the specialist services and the SMS medical college 10 seaters. Super specialist services. All district hospitals were functional as hub till March 2022. In 2023, after posting of the CHOs, this growth is a very high, about 3,45,000 considering done till November 22. Total 3,97,000 considered done by, in November 22 with the e-Sanjeevani HWC portal. 38 district hubs are functional. 1100 20 1700 consultation in the May 2020, 21-22 11,000 consultations, 21 to 22 94,050 94,000 completed till March 22. Please. Next, please. The E70 HWC process are these at this SKOCH level. Registration and connectivity. Register a new patient. Create case for the registered patient. Upload medical records. Update if any examination done. Update the allergy if any. Update the problem if any. Update the diagnostic test done if any. Update and the query if any. Select the health facility to connect and select the doctor to connect. In the other hand, of the hub level, as call received at the SKOCH, a pop-up window open at hub level. All information filled at the SKOCH level will reflect at hub. Doctor will provide diagnosis and the medicine as consult to doctor. After that, a prescription generated. This is the last is the prescriptions. Next, please. Next, please. In the on the other hand, each new OPD process it is a sort of difficult process. First of all, mobile. Download the application on the mobile, then registration and token generation system is there. Patient login, verify mobile number using OTP, fill patient registration from form, request token, upload health record if any, receive patient ID and token through SMS, patient's login, add family members, and then login, wait for the SMS, not wait to the login with the patient ID. There is a waiting room. Enter in the waiting room. Call now button will activate in something sometime. Initial video call. After that, doctor will show up. Consult doctor. Get instant e-prescription. This is a prescription which is prescribed by the doctors. Next, please. This is E70 HWC. I say that Chiranjeev is in the Chiranjeev Shivir from November 21 to 20, March 21. There is 40. About 49,000 consultation done. After March 22, in the Rajasthan, about 6,400 seats posted in the various health and wellness center sub-centers. Then shows in the April to June in the Rajasthan block health melas are organized. There are multiple sessions for the teleconsultation organized. Due to that, these peak are visible. On the other hand, each OPD peak shows at the time of the COVID. Thereafter, this is decreased because this is unfamiliar with the mobile applications. Next, please. Next, please. Role of the CHOs. Community health officers. The important performance by medical officer. Challenge is that call drop due to the network issues. For the solution of this, Government of India provide fiber connection to each sub health center June or July, up to July. Beneficiary may not be techno friendly for each OPD. Next, please. Impact social economic of the implementing the improve and increase access to the healthcare services, reduce out-of-pocket expenditures, prevent loss of wages, avoid distress family and attending going through by conservative estimate approximately 1,000 saved on each teleconsultation, daily wages, transport and food, etc. till date for total 3,97,000 consultation saving for common is upward for 37 crore rupees. Key outcome comparison chart for district wise and the overall state depict that there is a remarkable increase in number of the teleconsultations. Total consultation during the financial 21-22 was 54,000, which was increased to 3,97,000 in the financial year till date due to availability of the CHO from the April 22. Therefore, beneficiary availing the medical services through telemedicine increase. It also shows that people living in the remote area are getting consultation from specialists. Next, please. Next, please. Thank you.
How is it? The Government of India also provides e-Sanjeevani services. So how this is different from that?
Yeah, this from Government of India.
So what is your role in it except implementation?
Madam, we established district hub and the state hub. This is the initiative of the Rajasthan.
Okay. So establishing means what? Just giving the, it is a desktop application. Right. So anybody having a computer system with a camera on that can do the facility. So what exactly did you do?
Voice is not clear.
Well, this is a desktop application, web-based.
Yeah.
Okay. So you just need a computer with a camera. That's all.
Yeah.
Okay. So what exactly? And all the hospitals have already been provided with the facility.
Yes. Yeah, madam.
So what exactly did you do? Except maybe you have to schedule the appointments, like when it will come, like once a week, twice a week, or whatever time and all that. Except that what exactly is your role?
मैडम इसमें बेसिकली क्या है कि पेशेंट हेल्थ सेंटर पे जाता है, प्राइमरी हेल्थ केयर पे ग्रामीण लेवल के अंदर, वहां जाके वो कंसल्ट करता है, तो उस समय हमारा जो भी स्पेशलिस्ट एक्टिव होते हैं उससे वो सीएचओ से जोड़ लेते हैं और कंसल्टेशन कराते हैं।
हाँ, तो इसका मतलब आपने कोई शेड्यूल भी नहीं किया, कभी भी आते हैं कर दे। और सपोज अदर एंड डॉक्टर
ये हॉस्पिटल ओपीडी आवर्स में ही करते हैं इसको, बेसिकली ओपीडी आवर्स में।
नहीं और तो ठीक है, तो उस टाइम डू यू नीड टू से दैट अगर हमें ये स्पेशलिस्ट चाहिए तो उसी स्पेशलिस्ट के करेंगे, सो एवरी डॉक्टर इन द हब will be having the facility. Is that what you are saying?
Yeah, in every district hospital there is a specific panel.
No, वो तो ठीक है, every district hospital में there are many specialists and every specialist
हमेशा एक्टिव रहते हैं इसके लिए, every specialty से
शेड्यूल करना पड़ता है।
7 स्पेशलिटी मैडम, 7 स्पेशलिटी डॉक्टर्स एवरी टाइम हमारे एक्टिव रहते हैं इसके लिए।
उनको कैसे भेजें?
7 स्पेशलिस्ट में
यस,
उनको इसी एक ही जगह पे फैसिलिटी दिया गया है, या उन्होंने जो अपना पेशेंट को देख रहे हैं उसी के बीच में इसको देखते हैं?
नहीं, उनके लिए स्पेयर टाइम किया गया, उस दिन उसको फ्री रखा जाता है स्पेशलिस्ट को।
हाँ, सो बेसिकली शेड्यूलिंग, दैट्स व्हाट आई एम सेइंग। Scheduling the doctors, what other activity have you done? Because it's a Government of India initiative. So what exactly is your role?
Our role is the implementing of this program.
ठीक है, okay, thank you.
So there is clarity is not there, as Ma'am Shifali is also asking you. What is your role and what is your innovation in e-Sanjeevani?
In our innovation, we established the specialist hub, super specialist hub in the state headquarters to give the consistent to the space in the district hospital for the super specialty medical college level. We initiate these district hub and state hubs.
Okay, thank you very much.
Thank you.
Sir, this is our next project, Raj Kisan Sathi project. This is a single integrated online platform for the farmers. Actually, this is a very innovative and enthusiastic project. In the budget of 2019-20, our Honorable Chief Minister Sir announced a single integrated platform for the farmers. Actually, earlier what was the scenario? There were so many portals. There were there were so many methods of applying for the benefits of the government schemes. Or generally, they were offline. Only application was used to come online, and after that, every process was offline. Nothing was online. So this project was conceived to provide a platform not only for the farmers but other also but the other stakeholders of the agriculture sector also. Next, please. Next. So the Raj Kisan Sathi was envisaged with the aim of ease of doing farming on the pattern of ease of doing business. This portal was launched in January 2000. Community and agri facilitation, that is for the government employees also of the agriculture and line departments. 4-5 departments like agriculture, horticulture, agriculture marketing, state seed corporation, state seed certification agency, agriculture marketing board, all are under this one umbrella, and there is a single portal for all these departments. So if any citizen wants to avail any subsidy or want to apply for any kind of facility which is being provided by these all 4-5 departments of agriculture sector, then there is a single portal, Raj Kisan Sathi. Around till date, we have developed more than 90 software modules, including 11. Next, please. Next. So here in this slide, you can see that there are 9 pillars of this whole project. Out of that, we have achieved 6 pillars, and we are working on 7, 8, and 9. We have created farmer data bank, and also all the major subsidy schemes are online right now. All the quality control process, that is the samples of seeds and fertilizers and pesticide are field functionaries for quality testing, that are also being made online. Similarly, all the licenses of the for the traders of the seed fertilizer pesticide, they are also made online. And there is a scheme for establishing agri processing units, that is also made online, and some buyer seller platforms are also provided to the farmers. The GIS based crop estimation, data analytics, chatbot, and artificial intelligence based crop disease management, the work is going on these 3 aspects. Next, please. Next, please. Next. The major features of the Kisan Sathi portal are, we are in every application, whether it is G2G, G2C or G2B, we are using Janadhar ID. As I mentioned earlier, it's a unique family ID. So all the details of the applicant are fetched from the Janadhar database. Nothing he has to write on the application form or fill the application form. Almost all the 80% of the applications are auto-filled like his name, caste, village, his caste, farmer category, whether he is small, marginal, or other than small, marginal, all are auto-filled. And so we are using, and the farmer need not to remember his user ID or password like that. Nothing is there. So we have also ensured business process re-engineering. Earlier there were lengthy application forms. We have reduced to a minimum information, and complete process is made paperless. Farmer need not to submit any copy of the application or hard copy of the documents. Earlier he has to apply online and then take out the print of the application and attach with the required documents and used to submit in the office. But now that has been totally removed, and whatever farmer has applied online, that is taken into consideration. Only no physical file is required for processing. Similarly, those who are applying for G2B services like obtaining license and other facilities of the government, they may also apply through using Aadhaar, and all details are fetched from Aadhaar. The complete process is paperless. When application is submitted, then our employees make document scrutiny online only, and since no physical file is available in the office, they only do all these processes online. Similarly, the administrative sanctions and financial sanctions, they are also issued online and are digitally signed. No use of pen is required in the complete process. And farmer is, earlier what happened, the farmer used to visit to know the status of his application, but now SMS alerts at each stage of process of application are sent to the applicant. And also there is a provision on the portal. He can simply put his application ID and and uh, can know the status of the application, what is the status of at present for the application. And as you know, when farmer applies, some land records are also taken from the farmers. Here in this case, we have integrated this portal with our land revenue department portal, that is e-Dharti portal, and land records is automatically fetched from the that portal. Simply farmer used to mention his khata number, khasra number, division number, and subdivision number only, and then all detail is fetched from that portal with the extent of the share of land he is having. So this is the complete online process. In this case, physical verifications are also made at two times. First, to see the feasibility, that is called pre-verification, and after construction of the asset or creation of the assets, like construction of the farm pond, construction of the water harvesting structure, establishment of the drip, sprinkler, pipeline, barbed wire fencing. Our employee visits the field of the farmer, and all the physical verification process is done through mobile app. And previous slide, please. Previous slide. So nothing is physically done, or everything is online. And as he submits the details of the physical verification, the system automatically auto calculates the subsidy, and agriculture officer who is sitting in the office then can draft the financial sanction on the basis of the auto calculation, and the same is sent for payment platform, that is integrated financial management of the state government of Rajasthan. The complete data is switched over from this portal to payment platform. There is no need to again making the bill on the platform payment platform, and simply he has to select the budget head and just to click, and the bill is sent to treasury for payment, and then from treasury to bank, and then in the account of the uh, uh, applicant. So accounts detail is also fetched from the Janadhar ID. Already the account is mapped in the Janadhar ID. So we nothing is offline, all the process is online. Similarly, registration uh, has to be done by the drip sprinkler suppliers, that is also online and geotag. Whatever asset has been created by the farmer, that is also geotag timestamp. So next please. So complete application process, physical verification process, issuing of the administrative and financial sanction, and sending of the bills for the payment, that is all online, nothing is offline. Next please. Here is a detail of some of the schemes in way giving details of the features. I will not go in the detail of that. Next please. We are providing so here this is the important slide. Here we have integrated this Raj Kisan Sathi portal with the various IT platforms and building blocks of the Department of Information Technology, that is e-Sanchar. All the SMS are sent through e-Sanchar, and Raj e-sign, all the e-sign digital signatures are made through this e-sign platform. So we have integrated all these platform with Raj Kisan Sathi portal, just for the sake of having speed and accuracy and also transparency. Next, please. Next. This is a list of the mobile apps. Around 11 mobile apps have been prepared for physical verification, for quality control, for seed certification. For seed growers, there is a separate seed certification. Actually, earlier what was there? Uh, uh, there were chances that our employee sitting in the village itself, filling all the forms of the seed certification. Now he has to go on field and take the photographs of the crop and then geotag that. So geotagged and timestamped photographs also coming, that this is ensuring the sanctity of the certification process. And similar the case is with
Sir, I request you to please conclude now.
next please. Next slide please. Next. So here it is also visible that we have made some buyer seller platforms. Suppose some organic farmer have some organic produce, he can use buyer seller platform. There's a one more mobile app, Raj Kisan Locust. Actually what happens in when locust attack is there in the desert area, our functionary goes for survey.
Sir, I request you to please conclude now.
So my concern is that we have not only prepared the DBT mechanism online, we have not only done the DBT mechanism online, we have prepared some informative and some survey type of mobile apps also to facilitate our government employees and also to have a proper decision making. Next, please. Only 1 or 2 slides are remaining. I will conclude. Next, please. Next. Next, please. So here you can see that real-time reports are available online. Next, please. Next. This is real-time subsidy reports, and various type of filters are also available to have proper decision making and monitoring. Next, please. Next. These are intelligent business intelligent dashboards which help in taking appropriate decisions at the level of various levels in the hierarchy. Next, please. Next. Yes, this is important slide in which outcome of the initiative have been given. I would like to request to jury to please listen for only 1 minute. Here, what happens out of this initiative? What is the outcome? First is enhanced budget utilization, because real-time monitoring facilitates the decision makers, also the hierarchy to emphasize the lacunae and to speed up the progress. Similarly, the transparency has also enhanced, because all the processes are geotagged, timestamps. Our functionary need to go there, and the human interaction has been minimized, and discretion of the employees also removed. Reduction in total turnaround time. Earlier, there were around 30 days were used, 15 to 30 days were used to process the application to reach the, even to reach the office. Now it is available real time. The important one was in the period of Corona, even when offices were shut down, the our employees used to dispose the work from their home, because all the applications were available online. Similarly, stakeholder database is created, and uh, as you know, around 30 and around, as I told, 30 lakh communities distributed, and 10 out of 10.5 lakh farmers applied for various subsidies. INR 481 crore DBT was done. So this is all about this application, which ensured speed, transparency, as well as enhanced budget utilization because of this, and uh, it facilitated each of the farmers. Thank you very much.
Well, your presentation was quite elaborate and self-explanatory. I have no specific questions.
No specific question, please.
Rajasthan's also dependent on agriculture, and thus farmer is the pivot of economy of Rajasthan. So many livelihoods concerns are dependent only on agriculture and other agro-based industries, and such other areas like horticulture, animal husbandry, dairy, fisheries also. So around 2/3 of the state's GDP comes from this livelihood of the state resident come from agriculture and allied activities, and 30% of GSDP comes from agriculture. Around 85 lakh families are dependent on agriculture. Considering this, this year in 2022-23, our Chief Minister sir presented separate budget for agriculture. Separate budget for agriculture. Actually, earlier, as a usual practice in almost all the states, the budget of agriculture is presented along with the other areas like medical and health, irrigation, electricity, like that, education. So from this year, separate budget was presented by our Honorable Chief Minister sir. He is also Finance Minister in Government of Rajasthan, with the vision of Samradh Kisan Khushal Rajasthan. And under this, actually, thematic concept has been taken, and accordingly 11 missions have been launched, and the departments involved are agriculture, horticulture, agriculture marketing, rural development and panchayati raj, water resources development, energy, cooperative and animal husbandry. All these departments are directly related to the well-being of the farmers and welfare of the farmers. So all these departments were brought under one umbrella of under unique separate agriculture budget in Rajasthan. Next slide, please. Next slide. Next slide, please, Team Scotch. So around 11 separate, distinguished and distinct missions were launched under the separate budget. First is Rajasthan Micro Irrigation Mission. In this major emphasis was on water harvesting and its efficient use. As you know, the Rajasthan is always faces challenges of water scarcity. That's why construction of water harvesting structures like farm pond, diggy, community water resources were given importance. And similarly, after harvesting that rainwater, how the efficient use of water can be obtained. So So, इसको बंद कर दो, इसको बंद कर दो, बाहर ले लो. So, construction of water harvesting structures, and after that promoting of efficient use of water, pipeline, drip, sprinkler has been taken into consideration, and area expansion under these drip and sprinkler has been thought and undertaken in this separate budget. Also, to push up the efficient use water technology, a center of excellence on micro irrigation has to be established in each of the 10 divisions. Rajasthan has 10 agroclimatic zones. In each of the agroclimatic zones, one center of excellence for micro irrigation is also planned in this budget. Second is Rajasthan Organic Farming Mission. Please, that is available in the previous slide, please, previous slide. Yes, correct. Second is Rajasthan Organic Farming Mission. In this, actually, there is a challenge to get organic seeds at the level of the farmers. So here in case, we have emphasized on availability of organic seeds, organic fertilizers, biopesticides, so that farmer can easily adopt organic farming on large scale. And up to now, there was no any board for certification, and for testing, farmer used to go to cover long distances. So in this budget, we have planned certification labs at all 10 divisional headquarters in each agroclimatic zone. Similarly, the third mission is Rajasthan Seed Production and Distribution Mission. In this, the major component is Mukhyamantri Beej Swavalamban Yojana. Actually, what happens? Farmers used to sow the seeds which are available with them, and for the seed replacement rate is very low in so many cases. So, how the seed improved seed can be spread over the small hamlets and far off villages. So this Mukhyamantri Beej Swavalamban, as this this is on the pattern of Atmanirbhar Bharat. So we are distributing foundation seed and certified seed of class 1, and then farmers produce and distribute among the peers and their relatives, so that improved seed is spreading across the state. So this year we have taken given the seed to around 2 lakh farmers. Similarly, there is a large number of mini kits are also being distributed to the farmers. Next is Rajasthan Millets Promotion Mission. Rajasthan, this year the United Nations declared the year of millets. So we have also emphasized, and separate mission has been constituted for this, and around we will cover 10 lakh small and marginal farmers to distribute improved varieties of these millets. Next, please. Rajasthan Protected Cultivation Mission. In Rajasthan, there and also in other states also, there is a threat of stray animals and crops are generally destroyed by them. So this year we have planned on large scale the provision of subsidy for establishment of barbed wire fencing in their fields. Next is Rajasthan Horticulture Development Mission. Uh, in this mission, we have proposed expansion of in the area of fruit orchards as well as in the
Actually, you are running short of time. So instead of telling, because we are already seeing the slides, if you can tell us what is the outcome, that will be probably better. We can understand.
Yeah, right, ma'am. So actually, we have in this budget we have included the modern technology as well. We have made the provision of drones and improved implements to the farmers, and also the value addition aspects, and they have provision for establishing of food processing units at the farmer level as well. This budget, next please, this budget also includes agriculture education and provisions to provide smooth electricity to the farmers like that. So as ma'am had said that I have shared these slides already. The main target groups in this budget are our small and marginal farmers, and more than 80% farmers are in the category of small and marginal farmers. So earlier the provisions of subsidy were up to 40% or 50%. That has in so many cases it has been increased to up to even 75%, so that small farmers can create assets which can raise their income. So this is a unique separate budget. The main emphasis was to integrate all the sectors of agriculture into one, and to facilitate proper monitoring of the execution of the announcement made in the budget. This is all about this unique agriculture budget. Thank you, please. Any questions, please?
I presume your budget was for 22-23, right?
Pardon?
This budget is for 22-23.
Yes, yeah, madam.
So 7 to 8 months have passed. Can you tell us by doing this, because having special emphasis through the missions in 11 sectors is a good thing, because the implementation will be more rigorous and all. So can you tell us what see, at least one harvest has happened after that?
Yeah.
After the budget. So can you tell us what kind of production increase has happened in the agriculture sector? Or even take the rural development sector, has there been any increase in their outputs because of special emphasis?
Actually, the seed was also provided under Mukhyamantri B Swablaman Yojana and all other schemes, and the scheme implementation started with an emphasis of achieving targets within this financial year. So area expansion under DRIP and even in solar, it has increased. And Rajasthan is, as you know, Rajasthan is a leading state in establishment of solar pump sets at the level of the farmers. Similarly, area under the crops as well as productivity has also increased.
Okay, so can you tell us, by giving these free seeds and quality seeds, what is the percent of increase in the harvest?
Actually, the figures are yet to come, but area as I may explain that earlier the average area for Bajra was 42 lakh hectares. Now it has increased to 44 lakh hectares. Similarly, area under mustard, it was 28.9 lakh hectares in the 5-year average. This year it has increased to 37 lakh hectares. So it indicates that we will be having self-sufficiency in oil seeds in Rajasthan.
Okay, so good. The only question I do have here is that you are talking about bajra and say mustard has increased. Is it at the
Yeah.
expense of some other crop, or actually the land has been more land has been cultivated? Because that makes a difference. See, suppose I was doing rice and paddy and change it to mustard. So naturally, mustard cultivation area will increase, but my rice will decrease. So the question is whether by doing all these inputs, you have increased the area of cultivation, total cultivation, instead of doing this, that mustard has increased or bajra has increased. If you can say that whether total area of cultivation in the state has increased because of your inputs, because of good water supply, free water supply and all that, that will make a difference. Because growing mustard at the expense of say paddy or sugarcane or something, it could be anything, is not that much of a difference. But if more land has been taken into cultivation, that makes an improvement.
Yeah, ma'am. Uh, Actually, area is remains in Rabi season, area remains almost constant because that is dependent on total cultivation is dependent on rainwater. In Kharif, the area expansion depends on good rains. This year rains were very good, so that's why the area expansion also resulted out of that also. But in case of
Can
mustard,
you tell us previously what was the total area under cultivation, and by this input, what has happened?
in actually in Kharif, the total area, the average area was in around 160 lakh hectares. This year it has increased to 172 lakh hectares in Kharif season.
For maize only.
Yeah,
No, that's not my question. My question is, look, you are providing more seeds,
yeah,
quality seeds. You are providing water, free water. So by
yeah,
doing this, many of the people who were keeping their land fallow previously can be
yeah.
encouraged to start cultivating that land. Then let them cultivate maize or mustard or sugarcane. Doesn't matter, but at least they will do something and productivity will increase. What has happened to that? I'm asking that sector aspect.
Certainly, madam, area has increased in under sprinkler irrigation, drip irrigation, and that's why farmers are able to cultivate pulses and oil seeds on their land rather than simply going for the
Hello.
food other grain crops.
Can you give us some numbers?
Yes, ma'am. As I earlier told that in Kharif season there were the total area was 59 lakh hectares, and now it is 62 lakh hectares for food grains. Similarly, for pulses, the area was around 53 lakh hectares, which has risen to 98 lakh hectares.
So this is a very good rise.
Yeah,
Almost double, 80% or so increase. Good. Okay, I think, thank you. That's all I wanted to know.
thank you.
Thank you, sir. No specific question.
Sir, as I mentioned in the last presentation, seed is being made available to the farmers. This year, we have increased the magnitude. Earlier, only 2 lakh or 3 lakh mini kits were used to be distributed. Seed mini kits were used to be distributed to the farmers. And the basic, next please. The basic idea behind distribution of the seed is the popularization of the new varieties which are high yielding, and also there was a specific provision and content in this was that the seed will be distributed to the women farmers only for the just to ensure women empowerment. Actually, what happens up to now, every type of subsidy is given to the landowner. Whether women is landowner is or is not, that is not the criteria. land may be in the name of his or her, her husband, but the seed is given to the women farmer only of that, because in Rajasthan, government has launched Janadhar card on the pattern of Aadhaar card. That is a unique family ID, and in that detail of other family members are also there. Individual family members detail is also there, and that is Aadhaar seeded also. So under the 2023 budget, the under Rajasthan State Seed Production and Distribution Mission, it was thought that seeds, improved variety seeds should be distributed to female farmers, especially of the small or marginal category, because as I mentioned earlier, around 80% farmers are from small and marginal category. So this campaign was taken in this Kharif and Rabi season. Next, please. And from all over the state, overwhelming result was obtained. Seed mini kits were distributed free of cost to all the farmers. Next, please. Earlier, the approach was our field functionary used to prepare a list of the farmers to whom the seed mini kits were to be distributed. This year, we have changed the pattern, and total seed distribution system was made online, and many kits are being distributed online this year. Department, we have prepared a mobile app, and that is Raj Kisan Sathi verification app. As that is visible on the screen, there are so many functionalities in this mobile app, and under one, this mini kit distribution is one of the functionality. So our field functionary logs into this mobile app through his SSO ID, single sign-on ID, and then he proceeds for distribution. So this is complete paperless and penless process. Next, please. In this mobile app, masters of all schemes, sub-schemes, crops, their varieties, weight, quantity, all are available in this mobile, and field staff need to select from drop-down only. And Janadhar ID, unique family ID, that is used to distribute mini kit. So once the our field functionary is selecting out of the drop-down, then he needs to enter the Janadhar ID of the farmer, and complete detail of the farmer is fetched automatically from Janadhar portal. So he need not to enter any detail of the beneficiary. Next, please. Then as he enters the Janadhar number, then list of the family members appear. Out of that, he selects the name of the beneficiary, particularly the female beneficiary, and then OTP is sent to the mobile which is linked with Janadhar card. And when OTP is submitted in the system, then name of the beneficiary appears in the list, and mini kit is given to the farmer. The next, please. Under this, next, please. Similarly, a SMS is sent to the beneficiary containing name of the crop, its variety and quantity made available. System ensures deduplication, because once the mini kit is distributed to some a particular farmer, the other it cannot be issued double. And real-time reports of progress of distribution is also available across the hierarchy. At the time of mini kit distribution, geotag, timestamp, photographs and of beneficiaries are also uploaded on the portal. Next, please. Next. So here is a detail of the Kharif crops. Around 6-7 Kharif crops we have covered, and in Rabi crops there are also 6-7 Rabi crops, including fodder crops, because Rajasthan economy is also dependent on livestock. So we have also distributed fodder crops, mini kits, and around more than 30 lakh mini kits have been distributed. Still, some of the fodder crop mini kits are also in pipeline. Next, please. Here are some pics which are depicting that there was a overwhelming response all over the state. Next, please. So, next, please. Next. As ma'am has inquired about the quality of the produce, actually, the outcome of the initiative was enhanced productivity, production, and quality of the produce. Because especially in tribal areas and remote areas, where access to improved seed is somewhat typical, and usually farmers do not travel to get seed of improved quality. That seeds are also too much costly. So getting improved seed free of cost, it is a major concern for them. And here in picture you can see that almost all the farmers were benefited and realized very good production. Next, please. So the outcome, the major outcome I have jotted down in this slide: the improved seed availability to large number of small and marginal farmers. The major outcomes are improved seed availability to large number of small and marginal farmers. Similarly, the area under bajra, maize, and mustard has increased. Bajra from 42 to 44, maize from 9 to 940, mustard from 28 to 37 lakh hectares. The important aspect is doorstep delivery of seed mini kits. And one important aspect, as I mentioned, is women empowerment. Women feel honored and their role in family seems raised and recognized. And one more outcome is enhanced transparency in mini kit distribution. Actually, the discretion of the field functionaries have been avoided, and auto deduplication of beneficiary ensures also transparency. Real-time reports are available, and farmer data as you are seeing here in real-time district-wise, crop-wise reports are available. Next, please. Even beneficiary-wise detail is there. So everything is online. Nothing is to be written by pen, and real-time reports help here in the hierarchy to monitor the distribution progress. So the main idea was to made available the seed to the particular target group with timely availability of seeds and with transparency. Though, so we have ensured 3 T's out of this application, the online distribution of seed mini kits. Thank you very much.
Well, it's a very good initiative because we are not only providing them with good quality seeds, we are also monitoring them and ensuring that proper distribution is happening. I have no special questions. Thank you.
No questions, sir. Thank you.
It's well said.
Thank you so much. Thank you so much. So, first of all, a very good morning to all the jury members and my peers who are present in this session. Myself, Ashutosh Kumar Sharma, legal consultant with Haryana Micro and Small Enterprises Facilitation Council. We are representing Haryana Micro and Small Enterprises Facilitation Council, which is a quasi-judicial body under the Directorate of MSME Haryana. So we are presenting our project regarding delayed payment disputes. So if jury member permits, may I start with my presentation? Slide.
Yes, please.
Yes, so please share the slides. Second. Yes. So first of all, with the introduction, I am starting with the introduction. The Government of India enacted the Micro, Small and Medium Enterprises Development Act, which is namely MSME Act in the year 2006. So the objective of the act was to provide for facilitating the promotion and development and enhancing the competitiveness of micro and small and medium enterprises. So basically, this act was enacted in June 2006, but it was came in effect from 2nd of October 2006. And earlier, the government was having interest on delayed payments to small scale industries. This was Act of 1993, which was repealed by the MSME Act, and this new act was came in existence. Next, please. So now delayed payments to micro and small enterprises. Chapter 5 of the MSME Act deals with the provisions of delayed payment to micro and small enterprises. Basically, section 15 to 24 comes under the purview of chapter 5. And the crux of this chapter is that in case a supplier is a micro or a small enterprise, medium is excluded. This is specific for the micro and small enterprises. So in case a supplier is a micro or small enterprises and he had supplied some goods or rendered any services, then in such situations, the buyer, whosoever is the buyer, he has to make the payment on or before the agreed date. And the MSME Act is very clear about this. Section 15 very clearly says that this agreed period shall not exceed more than 45 days. So basically, the central government idea of central government is that whenever a micro or small enterprises render any goods or any services to any buyer, be it a government organization, be it a private sector organization, so the buyer is liable to make the payment, and the payment has to be made within the agreed period, which cannot be beyond the 45 days. In case there is no agreed period, there is no written agreement regarding the term of payment, then the outer line is of 15 days from the date of acceptance of goods or deemed acceptance. In case the buyer fails to make the payment, there is a heavy penalty on the buyer. Section 16-17 very categorically says that the buyer is liable to pay the bank compoundable interest with monthly rest at the 3 times of RBI bank rate. So this is a very serious provision, and for the welfare of micro and small enterprises, this has been incorporated in this chapter. So next, please. Now coming to the Haryana Micro and Small Enterprises Facilitation Council, which I am a part of. So this is a quasi-judicial body which was notified by the state government in the year 2007 under the Haryana Micro and Small Enterprises Facilitation Council Rules 2007. So the objective of the council is to facilitate the recovery of delayed payment of the micro and small enterprises situated within the state of Haryana. So what we are doing, we are dealing with the delayed payment disputes of our micro and small enterprises which are situated in our states who had supplied any goods or services to the buyers anywhere in India. So we have repealed our 2007 rules and came up with Haryana Micro and Small Enterprises Facilitation Rules 2021, which are now in force, and we have majorly amended few of the provision, and we had added a new provision for recovery as well, because enterprises were facing some issues of recovery. So we had made a provision for recovery of dues as an area of land revenue in our rules. So first of all, I will start with the process of claim to brief you about what is the process to file a claim in our council. Firstly, whosoever is an aggrieved micro or small enterprises, they are required to file their case on MSME Samadhan portal, which is a central government portal created by the Ministry of MSME, Government of India. So this is an online web portal where a claimant who is aggrieved, who has not got the payment from buyer on time, so he can file their claim on the portal. After 15 days, minimum 15 days, because from portal and automatic intimation is sent to the buyer that some case has been filed against you, so you are advised to settle. In case they didn't settle, then after 15 days, claimant is required to submit the hard copy of his documents along with requisite forms in our council. So we accept in our rules, we have specified formats for everything. We have form 1, form 2, in which the claimant has to file his claim petition. After receiving the claim petition, if the claim petition is fit and fine, if we see that claim petition is okay, documents are complete, after scrutiny, then we issue a response letter to the respondent seeking his response on the same. In case there are some deficiencies in documents, we do intimate to the claimant. We write an email as well as letters that this is the deficient document, please make it complete and everything. After completion of pleading, after issuance of response letter, the cases are approved by us on the portal. Then cases are getting permanent numbers, and we list those cases in our meeting. So what we are doing, please next. So yes, after approving of the case, we make sincere efforts to reconcile the disputes. We give 2 to 3 opportunity to both the concerned parties for reconciliation. We issue them notices, we call out in our office, we ask them to reconcile, we help them to reconcile. So in case parties settle the dispute during conciliation, we are more than happy to assist them. But in case they are not reconciling, there is some dispute which require further adjudication, then we forward the cases for the arbitration, which is our next stage. So in process of arbitration, we ourselves also conduct the arbitration proceeding, and we are also having some impaneled experts on our panel. As on date, 25 or 24 experts are there. Most of them are retired judges from district court, high courts, and few of them are very very experienced lawyers also. So this is our process. So after forwarding the cases to the experts, as well as after taking up the case by council, we conduct arbitration proceeding for both the parties. There is a very nominal fee of the state government based on the claim amount, and thereafter conducting the arbitration proceeding, the impaneled experts submit a report, you can say recommendation of their own, in which they recommend their own decision, like what they felt after hearing the parties on merits. So preferably we should seek that report within 90 days, and after receiving those reports and of impaneled expert, we examine that report, we give a due opportunity to the party for rehearing, like if in case they had left any point or if there is anything else. And after hearing the report, finally we make a decision to pass the award or whatsoever is the decision of the council. So council take a decision only on the basis of majority of its member. So if majority approve the reports, then we go by it, and if there is something else, we duly note in our reasoned order. Please next. So main issues, actually we are working since 2007. So there were a lot of issues which we had faced and which we had tried to identify in this system. So first of all, delayed payment of micro and small enterprise by respective buyers. If I put up a data to the jury members, it will be very surprising that since 2007 to year 2017, in a span of 10 years, Haryana received only 182 applications of delayed payment. It was only 182. In the year 2018, the figure goes to 695, and in the year 2019, it crossed 1500 and it goes to 1652, and in year 2022, it's crossed 2500 as well. And in the year 2021, the figure has crossed the mark of 3000 to 3324. So this data shows that there is a high number of cases are getting in the council in every year. So buyers are not giving payment on time to their respective suppliers. So this is a major issue, delayed payment of micro and small enterprises by their respective buyer. The second issue is timely and cost-effective disposal of such disputes. If the MSME, if the micro or small enterprises go to the civil court, it takes around 2 to 3 years to get their decision in their favor, and it is also cost they also have to pay court fee and etc. So this was also one of the challenge. Then awareness among the micro and small enterprises. Basically, micro small enterprises, they are not very organized and they are situated in rural areas as well. So there is lack of awareness among them. So, and there is also lack of systematic data with them. They are not maintaining proper digital data. They are not having digital knowledge. So these all issues we have identified, and then the major issue was the recovery of delayed payment. Once the matter has been adjudicated, we have passed a decision in favor of the enterprise. So the next challenge was to recover that amount. So this was also one of the challenge. So please back slide. Yes. So the solutions we have implemented for this. So first, we set up this body in the 2007 as a quasi-judicial body. So we follow the mechanism of conciliation as well as arbitration to adjudicate our disputes. Then the second option was to figure out that how many hearings we need to tackle these disputes. So we are conducting regular hearings, around 3 to 4 hearings are conducted in a month for speedy disposal of conciliation as well as arbitration matter, to increase the awareness among MSMEs we keep advertising in our newspapers regarding this body and regarding the benefits of approaching the HMSCFC and what we are having, what are the provisions. Then involvement of field offices. We have also involved our field offices which are situated at each district to make aware the associations, industries about these provisions, about their recovery mechanism, so that they can approach the council and avoid the lengthy and other time-consuming processes. So they are approaching, and Haryana is third in the whole country in terms of receiving number of applications. If we see, we have received more than 10,000 applications. And lastly, we had also conducted the hearings through video conferencing, because everyone is aware that during the difficult period of COVID-19, it was very difficult to conduct the hearing, and it was not possible to hear the matter and to adjudicate this dispute. So, with the directions of Honorable Supreme Court, Honorable High Court, we had also started our mechanism of online hearing. Then we also identify the non-responsive cases, and we also tackle them, and we also approach them with our emails and notices regarding their claim case, because sometimes people are filing claim on Samadhan portal, but after filing the claim, they are not approaching to the council. So we ourselves identify such cases and send emails and reminders to them that this case is pending. Please update the status whether you have received the amount or not. In case you have not received, this is the procedure. Please approach us and we will get into the case. So next is total 2,321 cases have been disposed of by the council till date, wherein an amount of around 600 crores. If I go to the exact amount, then 594.2974 crores have been disposed in these matters. In the year 2007, we have framed our rules, which we have now repealed, and now HMSCFC rules 2021 are in process. In these rules, we have rationalized our process of arbitration. Now we ourselves conduct the arbitration. We also seek the help from impaneled experts. So this is the exercise to reduce the time, to reduce the turn-up time of the cases. And the major provision which many other states are also looking upon to us is the recovery of dues as an area of land revenue for the decisions made by the council. So initially the enterprises were facing the issue of recovery. Once they were having a decision in their favor, they were not able to recover that. But now we have made a provision. So now our decisions are recoverable as an area of land revenue. We had also started receiving few applications under this provision, and all the applications are in process, and very soon we will recover these amounts through our collectors and through the district collectors. So please next. Going with the statistical data of the council, we have received total 10,772 applications till yesterday, in which we have disposed 2,872 applications which have already been disposed, and 2,122 applications have been rejected. In rejected is the cases where claimant filed the case on the portal, but they have not approached to the council. So after going to the council, after sending them emails, reminders, they didn't turn, then only we have rejected these cases, meaning by whether maybe the claimant has received the payment or is not interested to proceed further. So as of now, total 2,000 cases are in our process, which are at different stages of arbitration as well as the conciliation. We are conducting arbitration by ourselves also. Some of the files are with our impaneled expert. Few cases are in process of conciliations as well. Now the cases for follow-up is 3,635. So this is the figure wherein the claimant have not approached to the council, and as I discussed earlier, that we are in process of sending specific emails and notices to each of them. After giving due opportunity, we will figure out whether to reject these cases. In case the claimant will approach us, we will process these cases further. And total 143 applications are for last 15 days, which are not actionable yet, because I discussed earlier that only after the 15 days time spent, we will be able to take action on this application. Please next. So coming to the future plans of the council, what we are planning for coming times. So after COVID, we have developed a need of a separate web portal, and we thought that there is a high time to switch over to the online mechanism and to reduce the physical interference. This will also turnaround time of disposal of cases will be reduced, because parties can file their cases, and format of final awards and decision have also been simplified. So once this portal will be in process, I am very hopeful and very sure that parties will be very benefited to this approach of the council, and they will have more access to the council, more frequent, more user friendly. So next is just a highlight of our achievements. So this council was awarded as second best performing council in terms of absolute number of cases disposed of by the council by the Chamber of Indian Micro, Small and Medium Enterprises during a one-day table conference of chairpersons, and in the chairmanship of additional secretary and development commissioner, Ministry of MSME. Recently in April 2022, we had also received the certificate and award of outperforming council by the Honorable Minister Sri Narayan Radeji, Government of India, in MSME Awards 2021. And HMSCFC is third. Actually, I had discussed this. We are at the third number in whole country in terms of receiving the delayed payment disputes. Just because of our awareness and sincere efforts, more and more enterprises are relying on us. They are approaching us instead of going to the courts, and we are trying very hard to recover their payments as soon as speedy, as effectively as we possible. So thank you everyone. Thank you jury members, and the stage is open for any questions and everything.
I think it's a wonderful achievement you have done, and being third in the country is really good. But I have little confusion. In the beginning, you said the claims are processed through accepting applications online portal. Now you are saying that you are going to go for your own, that as your future plan, you are going to have your own portal. So does it mean that the portal you are talking about is a part of some other enterprise?
Yeah, actually, the portal is of central government, which I was talking of in earlier part. This is a Samadhan portal of central government, and it was created basically for monitoring purpose. So the data is basically fed in terms of monitoring purpose. So it is only an initial step, and we are developing a full module of complete online.
So my next, in that case, my next question actually becomes redundant, because I wanted to know whether it is the entirely online process of disposing or doing. But since you are only taking data from the government, central government portal, you are processing it offline. Is that
Yes,
what I?
Yes, yes. As of now, we
So that means you are planning, your future plan involves that you will make a end-to-end online processing.
Yes, yes. We will make an online process where filing will be online, hearing will be online, and
correct. And that will of course reduce time. So what is the time right now taking for disposing one
yes, in one claim application, basically,
if it is not dispute going to dispute register, just a normal routine
just a normal routine, then in such case we are giving 15 days time. Once the claimant has filed documents with our office, we examine the documents within 5 to 7 days. We issue a response notice of 15 days to the respondent. In case response is received or not received, irrespective of that, we put up the case in next immediate meeting of the council. Every month we conduct 3 to 4 meetings, and we sit on table with both the parties. We make sincere efforts to give them a proper understanding. We give them to reconcile their lasers, seek assistance from our account officers as well. And in case matter is settled, so around within a 2 months or 2.5 months, basically, if there is a no dispute, then parties can get their payments. And in case matter is disputed,
fantastic. I understand now the process. So you are taking all care to handle the dispute as quickly as possible. Great.
Yes,
thank you.
yes.
Thank you.
Thank you.
Good effort, sir. But what is innovation in this? This is a normal routine government exercise for dispute resolution. So what innovative ideas or method have you adopted?
Innovative idea is for making this process online, because all states are having this offline process. They are making their claimants to come down to their offices and sit there with the conciliation proceeding. So Haryana has started this process, and we are in process of developing an online portal. So this will be very friendly for the users. If like someone is situated in Gurugram, he doesn't need to come all the way to the Panchkula for his dispute of 1 lakh or 2 lakh. He just have to file his claim online portal. We will give a hearing date. We will hear him on the portal itself. And in case respondent is there, we will make sincere efforts on the portal itself, and we will figure out the best possible solution for both of them. So this is our approach, that we will go up with a portal of our own. Although the mechanism is very simple, all the states are following it in physical manner, but Haryana has given a thought to the online process of all this system. And during the COVID time also, I'm not aware about the other councils, and as far as I know, Haryana was the only council who was conducting online hearings as well on the module of courts. So basically all the departments were not unfunctioning at that time, and during COVID also we had conducted hearings and we had settled the disputes. So this is our best effort we can make, and we are trying hard, and we had also made a mechanism of recovery as an area of land revenue. So basically maximum councils are giving awards. After passing the award, the unit has to approach to the court for execution. But now we are trying that execution processes will be also be taken care by the council itself. We have amended our rules. We have started receiving applications. Now we will take our collectors in our loop, and we will try to recover those amounts as an area of land revenue.
Okay, good enough. Thank you, sir.
Thank you so much.
In the form of a presentation?
Yes, sir.
Okay. On the behalf of Rajasthan State Health Assurance Agency, I, Rajkumar Shivani, Executive Director, Policy, welcome you all. And I'm just going to tell you about what the best practices under Mukhyamantri Chiranjeevi Swasthya Bima Yojana we have adopted. Slightly going first to those things, I would like to tell what are the key features of this scheme. Basically, it is a, if you see, just a moment, please. I am looking. Yes. It's a health insurance scheme, and in that what we do, we provide to all beneficiary a kind of health insurance in that they can go to any impaneled hospital, it may be a private or a public hospital, and get benefits related to their health problems. So if we see at this moment, Rajasthan is covering 1.35 crore families in that scheme. Into that, NFSA, that is National Food Security Act, the people coming into that, SECC, the Socio-Economic Caste Census, which was held in 2011. People are around 1.07 crore. Similarly, all contractual workers working in the Rajasthan government, around 0.52 lakh, they are also included into that. Small and marginal farmers, they are also included into that. And in the time of COVID, the families who got ex gratia from the government, they are also included that. All these are actually having or coming into the free category. That means no premium is being asked from these category. The other persons, all citizens of Rajasthan, are also eligible, and they can pay their premium and come into this policy. So in that manner, this scheme is a universal health insurance scheme. So what has happened earlier, whatever the schemes were running out, they were just targeting few sections of the society. The Rajasthan has come up with that universal health insurance idea, and it has opened for all citizens that they can come and can avail this insurance scheme's benefit. So that is why we are called now. The important thing is that what is the mode of that? That means mixed mode. Mixed mode means there is insurance for the people, and over and above, if there is another expenditure related to health insurance or the health benefits to the citizens, it will come under the trust mode. That means all the expenditure would be borne by the Rajasthan State Health Assurance Agency. That means the government of Rajasthan. What I am telling you, I will also tell you in the few slides, next slides. This is what all about. At this moment, 1,662 per family per year is the premium which we are giving to the insurer. We have got an insurer for this scheme. 1,572 packages are there for the citizens available for their health benefits or their deficiencies, diseases, whatever we can call it. And what I was telling you, trust mode, that means they are the pure packages which are borne by the Rajasthan government. Insurer is not involved for these packages. They are around 61 packages. So there are two kind of things. One is insurance mode, one is trust mode. That is why we are calling it mixed mode. Coverage. If you see, the coverage is very high. In general, all other schemes in the country or even other states which are running, they are having around 3 lakhs or 5 lakhs. This is a modern standard 5 lakh rupees. But Rajasthan has gone upward and it has made it 10 lakh rupees. From here, you can understand, for 5 lakh rupees, we have got an insurer with us, and this scheme is run on insurance mode. If there is some expenditure above that 5 lakh rupees for a family in a year, that would be borne by the Rajasthan state government. That is why we are calling it the trust mode. So above the 5 lakh rupees, anything is there, it would come into the trust mode, and the limit for that is rupees 10 lakh per family per year. So this is a huge coverage. So we have got empaneled hospitals for that particular benefits. The government hospitals are there 801 and as well as private 855. In that way, if we see, there is a huge accessibility also for the beneficiaries. So now we will come to the point that universal health insurance coverage. This is what I was telling about you. Rajasthan has come up with that in the way it is a pioneer also. That how we have transformed a simple insurance scheme, which were targeting only few sections of the society. We have made it universal. That means now each citizen which is enrolled here in Rajasthan, we have got a Janadhar database also into the Rajasthan. All are entitled to come into this scheme. Few exceptions are there. They are like the persons who are working in Rajasthan government, employees of the Rajasthan government, pensioner of Rajasthan government. They are having a different scheme that is called RGHS, Rajasthan Government Health Scheme, similar to the CGHS, Central Government Health Scheme. All the exceptions are those people only. Any other citizen is allowed to come into that scheme. So in that way, if we see any person from all households, at least one person is covered by health insurance. Rajasthan is coming at the top of the state in the country. We are around 88%. We are providing 88% coverage. 10 lakh risk cover. This is what I was telling you. This is the huge. I think this is the biggest also in the country. No other scheme is running in that way, which is providing 10 lakh rupees risk cover. We have got some special provisions. If some kind of coverage is not available to a family, say, and it comes up and it says that we are not still covered, we have given some approval rights to district magistrates that they can approve their application and directly they can get benefits, as well as their registration process is also being completed with their approval. This is what I was telling you. Andhra and Rajasthan are at the top of that coverage. If you see at the average of India, it is around 41%. And Andhra, Rajasthan are around 80, more than 80. So Rajasthan and Andhra both are, in terms of health coverage, insurance coverage, are at the top in the country. One more innovations we have introduced. Rajasthan has come up with this idea also. We all know that organ transplants are very, very expensive. So for those families which are in need of that kind of organ transplant surgeries, we have given that coverage beyond rupees 10 lakh rupees. That means, say, for a heart transplant, some family is having expense of more than 10 lakhs, say 15 lakh, 20 lakhs. So above that 10 lakh rupees, Rajasthan government will bear that kind of expenditure also. for their beneficiaries. I have already told you 1633 packages are there into it. 61 packages are provided on trust mode. That means it are completely to the bond by the Rajasthan government. So one of them are these organ transplant packages are also there. At COVID time, we introduced COVID packages, mucormycosis packages. They are also being run on trust mode. For the next phase, we have also come up with the fast coverage. We have formulated 1764 packages also. The most important thing about the health insurance is that once a family or a family member goes into the hospital, the proper identification is to be there. And this is the most important thing related to health insurance. So what we have done, we have introduced our own online identification system, and which is based on the Aadhaar authentication. So I am happy, or I would like to tell you that 95% verification is being done through Aadhaar authentication at this moment on our transaction management system, that is called TMS, which is completely online. If there is not authentication is not being done, there is another mechanism where we used medical officer in charge, MOIC, of that hospital. It uses its way of mechanism to authenticate that. But the most important thing is that we are verifying 95% at this moment. This is what we all know. If there is a online system, it has to be in a secure and encrypted way, which is there. It is completely online, automated. In Rajasthan, we have got single sign-on. There is one platform called SSO, single sign-on. Every citizen can enroll himself into that single sign-on and can get all the facilities related to Rajasthan. So our health insurance scheme, this is Mukhyamantri Chiranjeevi Swasthya Bima, is also being integrated with single sign-on. Any citizen can go into through SSO, single sign-on. Any citizen can register and see their status related to health insurance schemes. This is integrated with UIDI, which is what I was telling you. We are doing authentication on the basis of Aadhaar. If you see, for health insurance schemes, there are always claims raised by the hospitals, and they have to be reimbursed. There is a cycle of money related to the hospitals. So there are strict turnaround time in our scheme. And if you see, we have got a turnaround time of 15 days, and around 94% claims are being settled in that turnaround time, which is very important related to the health insurance schemes. And this is what I was telling you, that the vast network we have got gradually. We have started with few hospitals, and now we have reached at this level. That means a good kind of accessibility for all the beneficiaries across the state is there. Around 1656 EHCP, that means impaneled hospitals, impaneled healthcare providers are with us. They are providing benefits to the beneficiaries.
Sorry to interrupt you. You have another 1 minute.
Okay, I will make it fast. So if you see, we have treated around 28.8 lakh people. Number of claims are approved 54. We have given 2,800 crores from that inception of the scheme. The most striking thing is that approximately 9,500 per day claims are being raised into our system. Other initiatives we have started, that is the Chiranjeevi Jeevan Raksha Yojana. That means if there is a road traffic accident, our all EHCPs will provide benefit to the victims up to 72 hours. Similarly, there is accidental insurance related to the all beneficiaries of Mukhyamantri Chiranjeevi Swasthya Bima Yojana. It is up to 5 lakh rupees in the case of death of the beneficiary. I have already told about COVID and mucormycosis case packages. We have already included into our trust mode. We have got plenty of success stories. Liver transplants and other transplants have been started. Plenty of huge amounts were there for their family members. People got it, and they are getting benefits from the this scheme. Thank you very much. And I would welcome all you that if there is any kind of question, I would be happy to tell you. Thank you.
Yes, health, taking care of health is really important for any state or any country who's working, and you are providing a good service. This scheme is good, like up to 5 lakh in insurance mode and 10 lakh in trust mode, mixed mode or whatever. That's good. You have given all kind of information which is very encouraging also to people. How many have you actually done, and what is the time taken to process? Suppose somebody goes for a transplant in a trust, and then the hospital needs the money upfront. What is the time taken by the government to release that money?
This is what I was telling you, that within 15 days we are providing money to the hospitals. That is coming back to the hospitals.
See, the point is, sometimes the hospital needs money before the patient is admitted. So 15 days may be too late for such kind of emergency operations.
No, I would like to tell you, this is very most striking feature also of this scheme, that this is a cashless scheme. And once a hospital is empaneled with us, they are known about that. This is a kind of cashless scheme.
Okay, so they don't have to worry about that.
Yes.
Okay, fine. Thank you. I have no more questions.
Thank you.
Sir, as CGHS is doing, they are providing OPD facilities, and they give you medicine whenever you are sick. So is your scheme is also doing that like that, or only when somebody get admitted in the hospital, then only reimbursement will be there?
Yes, sir, you are on the correct direction. That is right, sir. It is only IPD. That means there is no OPD including into that. It is kind of same health insurance scheme where most of the times it is IPD.
So why, how it is different, or how it is innovative? Because it's a business as usual. Other agencies are also doing the same thing.
The most important thing is that we have made it universalized. If you see, if you go into the private sector company, for 10 lakh rupees, the amount would be around 15,000 per annum.
That is correct. That is correct.
And yes,
that I already you have covered in your presentation. Only thing, what is innovative in your scheme, which others are not doing? Because CGHS is very good scheme. They give you medicines whenever you're sick, and they reimburse your money whenever you are admitted in the hospital. So is it like that? And their turnaround time is also very less. So are you do you have a better system than CGHS?
Yes, I would like to tell you that this is what I am telling you, that we have got online transaction management system. CGHS is still lacking behind that kind of thing. All the transaction, I told you, 9,500 claims per day are coming into our system. So, and we are covering a vast area, and you see 1.35 crore families are covered. So in that way, it's we have got a robust system related to their identification of the beneficiaries and providing them health benefits.
Okay, thank you, sir. I got it.
Thank you, sir.
राजस्थान की तरफ से आप सबको प्रणाम करता हूं। क्या आप मेरी ये मुखबिर योजना की स्लाइड देख पा रहे हैं सभी सम्मानित सदस्य? मैं स्टार्ट करता हूं मैडम की परमिशन से। इसमें ये पूरे देश में PCPNDT भ्रूण लिंग परीक्षण, प्री कंसेप्शन प्री नेटल डायग्नोस्टिक टेस्ट, प्रोहिबिशन ऑफ सेक्स सिलेक्शन एक्ट 1994 अपने पूरे देश में सेंट्रलाइज एक्ट है। चूंकि हेल्थ एक स्टेट सब्जेक्ट है, इसलिए पूरे इंडिया में अलग अलग स्टेट के हिसाब से इस एक्ट को इम्प्लीमेंट किया जाता है। बेसिकली इस जो एक्ट को बनाया गया है उसको इसलिए बनाया गया है कि जो सेक्स डिटरमिनेशन के लिए जो टेक्नोलॉजीज हैं, लाइक अल्ट्रासाउंड है और दूसरी जो टेक्नोलॉजीज है, जिससे ये पता किया जा सके कि भ्रूण लिंग परीक्षण किया जा सके, भाई गर्भ के अंदर जो भ्रूण है वो लड़का है या लड़की है। तो इन सभी टेक्निक को रेगुलराइज करने के लिए और इन्हीं सभी टेक्निक को कंट्रोल करने के लिए एक्ट लाया गया था। अपन जब एनालिसिस करते हैं सेंसस 1991 का, तो सेक्स रेशियो, चाइल्ड सेक्स रेशियो था 916 और जो 2001 के अंदर 909 रह गया और 2011 के अंदर 888 रह गया राजस्थान स्टेट में। तो मैं निवेदन करना चाहूंगा, जब ये 888 रह गया तो ये बड़ी क्रिटिकल कंडीशन थी राजस्थान के अंदर कि भाई इतना कैसे सेक्स रेशियो है वो डाउन हो गया। तो गवर्नमेंट ने इस पर फोकस किया और सभी जो अल्ट्रासाउंड मशीन्स है और है इन टेक्निक्स को रेगुलराइज करने के लिए एक तंत्र बनाया, जिसमें स्टेट पीसीपी एनडीटी सेल बनाई, डिस्ट्रिक्ट लेवल पे डिस्ट्रिक्ट पीसीपी एनडीटी सेल बनाया, और उसके अलावा इन जो सेक्स डिटरमिनेशन केसेस के अंदर जो लोग इन्वॉल्व है उन लोगों को कैसे पकड़ा जाए और कैसे सेक्स डिटरमिनेशन जैसा मिनांस है ये इसको रोका जाए। तो इसके लिए राजस्थान गवर्नमेंट ने एक इनिशिएटिव लिया, मुखबिर योजना। मुखबिर योजना एक ऐसी योजना है जो पूरे स्टेट के अंदर जहां भी ऐसे जो लोग हैं या ऐसे दलाल से लेकर के या किसी भी इन्फ्लुएंस, कैसा भी इन्फ्लुएंस क्रिएट करके लोगों को ये बताता है कि आपके पेट में जो बच्चा पल रहा है वो लड़का है या लड़की है। तो इन चीजों को रोकने के लिए, बड़े स्तर पर रोकने के लिए राजस्थान गवर्नमेंट ने 27 दिसंबर 2011 को मुखबिर योजना लॉन्च की थी। ये इनिशियली मुखबिर योजना, मुखबिर ऐसे आदमी को कहते हैं जो इस प्रकार की सूचना लेकर के हमारों को देते हैं और उसके आधार पर हम कोई डिकॉय कार्रवाई की जाती है। इनिशियली ये जब 11 में लॉन्च हुई थी तो ये 50,000 रुपए की स्कीम हमने लॉन्च की थी, जिसमें 25,000 रुपए जब हमारे को दी गई इंफॉर्मेशन वेरीफाइड हो जाती थी और उसके आधार पर डिकॉय ऑपरेशन हो जाता था, तो हम 25,000 रुपए अकाउंट के, सीधा अकाउंट में हम मुखबिर के अकाउंट में ट्रांसफर कर देते थे। और सेकंड इंस्टॉलमेंट जो 50,000 की जो राशि थी वो 2 इंस्टॉलमेंट में हमने डिवाइड कर दी थी। फर्स्ट तो डिकॉय ऑपरेशन होने पे दे देते थे और 25,000 रुपए की जो राशि हम देते थे वो 25,000 रुपए की राशि जब चार्ज फ्रेम हो जाते थे एक्यूज्ड के अगेंस्ट ट्रायल कोर्ट में, और वो चार्ज फ्रेम होने पे हम 25,000 रुपए की राशि मुखबिर को और दे देते थे। तो यह 2 डिवाइडेशन की राशि थी। इस पर हमें कुछ 2012 में मुखबिर से सूचना मिली और उसके आधार पर हमने कुछ डिकॉय ऑपरेशन किए थे। लेकिन हमें ये आगे ये महसूस हुआ कि इस राशि को हम और बढ़ा करके ये डिकॉय ऑपरेशन की और ज्यादा महती आवश्यकता है कि इस घृणित कार्य को कैसे रोका जाए। तो हमने ये इस राशि को 26 मई 2012 को बढ़ा करके इस राशि को 1 लाख रुपए कर दिया। इसमें 1 लाख रुपए की राशि में हमने 3 महीने के लिए हो जाने पे फिर हमने सेकंड इंस्टॉलमेंट हमने दी 25,000 रुपए, फ्रेमिंग ऑफ चार्जेस बाय ऑनरेबल ट्रायल कोर्ट। आरोप विरचित हो जाते हैं कोर्ट के अंदर एक्यूज्ड के खिलाफ, तो हमने 25,000 रुपए की सेकंड इंस्टॉलमेंट इश्यू करते थे। इसके अलावा हमने 50,000 रुपए की राशि थर्ड इंस्टॉलमेंट के रूप में एक और रखी, जिसमें अगर एक्यूज्ड कन्विक्ट हो जाता था, दिए गए स्टेटमेंट एविडेंस विटनेसेस के आधार पर अगर एक्यूज्ड कन्विक्ट हो जाता था, तो हम 50,000 रुपए की मुखबिर को एक राशि और जारी करते थे। यह हम इसलिए करते थे ताकि मुखबिर जो है वो ऐसे एक्यूज्ड के अगेंस्ट जो भी विटनेस देता था, एविडेंस देता था, वो इतनी सॉलिड हो कि वो 50,000 रुपए प्राप्त करने के लिए अपने एफर्ट्स लगाए। फिर हमने इस राशि के आधार पर कुछ डिकॉय ऑपरेशन किए। इसमें चेंजेस की कुछ आवश्यकता महसूस हुई। क्योंकि जो फर्स्ट इंस्टॉलमेंट की राशि थी 25,000 रुपए, वो थोड़ी देखने में अमाउंट कम था। तो हमने जो आगे 30 जुलाई 2012 को एक इसके अंदर और अमेंडमेंट किया और इसमें हमने जो फर्स्ट इंस्टॉलमेंट की राशि थी वो हमने 50,000 रुपए कर दिया, ताकि जो मुखबिर जो हमें सूचना दे उसको हम और मोटिवेट कर सकें कि आप सूचना हमारे पास लाइए और 50,000 रुपए तुरंत ले जाइए। इससे हमारे पास में जो इसकी संख्या बढ़ने का, जो डिकॉय ऑपरेशन की जो संख्या इंक्रीज होने के हमारे पास में चांसेस और बढ़ गए थे। इन सब के बावजूद हमारे पास में इंफॉर्मेशन आने लगी। इंफॉर्मेशन आने के बाद में जैसे जैसे हम डिकॉय ऑपरेशन करते थे तो उसके अंदर हमें कुछ प्रैक्टिकल एस्पेक्ट्स के कुछ प्रॉब्लम आने लग गई। जैसे हमें गर्भवती महिला की आवश्यकता महसूस होने लगी, उसकी सिक्योरिटी के हिसाब से कुछ देखना पड़ने लग गया। तो हमने मैडम इसको 2015 में 1 लाख की जो मुखबिर की योजना थी उसको हमने 2 लाख रुपए कर दिया, 1 लाख की जगह। और इस 2 लाख को हमने 3 लोगों में 3 इंस्टॉलमेंट में डिवाइड कर दिया। 3 लोग कौन कौन से? जब हमारे को एक तो फर्स्टली एक मुखबिर हमारे पास सूचना देने आए, उसके आधार पर हम डिकॉय ऑपरेशन करें, और दूसरी इंस्टॉलमेंट हमने वही ट्रायल पे जो एविडेंस हो, विटनेस सक्सेसफुल हो जाए, और तीसरा थर्ड कोर्ट डिसीजन पे इंस्टॉलमेंट दे दे। 3 लोगों को किस किस को देते थे हम मैडम? एक तो मुखबिर जो हमारे पास सूचना है, दूसरा हम जो भी ऐसे मतलब ऑपरेशन करते हैं उसके लिए हमें एक प्रेग्नेंट लेडी चाहिए जिसके अंदर जो अल्ट्रासाउंड टेक्निक, जो भी रैकेट या जो भी पर्सन या जो भी डॉक्टर ऐसा काम करता है उसको वो वहां पर उसकी बकायदा सोनोग्राफी करे प्रेग्नेंट लेडी की, और उसको बताए कि आपके जो पेट में जो बच्चा पल रहा है वो मेल है या फीमेल है। तो हमें प्रेग्नेंट लेडी की बहुत ज्यादा आवश्यकता पड़ने लगी, इसलिए हमने प्रेग्नेंट लेडी के लिए भी 40% मतलब 80,000 रुपए की राशि उनके लिए भी सुरक्षित की। अब प्रेग्नेंट लेडी हमारे साथ में चलने के लिए, तो प्रेग्नेंट लेडी की बेसिक जिम्मेदारी हमारी होती थी कि प्रेग्नेंट लेडी की सुरक्षा की जाए, और वो हमारी प्रायोरिटी थी। चाहे हमारा डिकॉय ऑपरेशन सक्सेस हो या नहीं हो, लेकिन प्रेग्नेंट लेडी की सिक्योरिटी और उसके बच्चे की सेफ्टी की हमारी प्राइम ड्यूटी थी। इसलिए हमने एक हेल्पर को भी 40,000 रुपए राशि देने का हमने प्रोविजन रखा। इस प्रकार से हमारी ये जो 3 मेन जो पर्सन है, की पर्सन है, उनको हमने डिकॉय ऑपरेशन में इन्वॉल्व किया। अब हमें इस चीज की और महत्वाकांक्षा हो गई कि इस राशि को बढ़ाया जाए 2017 में, चूंकि डिकॉय हमारे पास सूचना भी आने लग गई थी, इसको और इम्प्रूवमेंट के लिए आवश्यकता थी, तो हमने ये राशि 2 लाख की जगह 2.5 लाख रुपए कर दिया। जो 80 हजार रुपए राशि हम पहले मुखबिर और प्रेग्नेंट लेडी को 3 इंस्टॉलमेंट देते थे, वो हमने 1-1 लाख रुपए दोनों को देना शुरू कर दिया और हेल्पर को 50,000 रुपए रखा। इस प्रकार से हमारे पास में खूब सारी इंफॉर्मेशन आने लग गई। अब बेसिकली क्या हमें कि प्रेग्नेंट लेडी की प्रॉब्लम आने लग गई हमारे सामने कि डिकॉय ऑपरेशन के अंदर प्रेग्नेंट लेडी हमें मिले या नहीं मिले। प्रेग्नेंट लेडी को मोटिवेट करने के लिए और ज्यादा इस डिकॉय ऑपरेशन में शामिल करने के लिए हमने 2.5 लाख रुपए की राशि पुनः 6 जुलाई 2021 को बढ़ा करके 3 लाख कर दिया, और इसको 2 इंस्टॉलमेंट में कर दिया। फर्स्ट इंस्टॉलमेंट डिकॉय ऑपरेशन होने पे, और दूसरा इंस्टॉलमेंट ट्रायल कोर्ट में सक्सेसफुल एविडेंस अगर विटनेसेस की हो जाए तो उसके आधार पर हम सेकंड इंस्टॉलमेंट जारी करते हैं। लेकिन इसमें एक देखने वाली चीज ये है कि जो प्रेग्नेंट लेडी है उसको हमने फर्स्ट इंस्टॉलमेंट में 50,000 रुपए किए, और सेकेंड इंस्टॉलमेंट में क्योंकि उसका जो विटनेस होता है, एविडेंस होता है प्रेग्नेंट लेडी का, वो बहुत इंपॉर्टेंट होता है, और उसके आधार पर ही केस के जो मेरिट डीमेरिट्स है, केस का क्या डिसीजन होना है, एक्यूज्ड को कन्विक्शन मिलना है या उसको कन्विक्ट होना है, उस पर डिपेंड करता है। तो हमने जो इंस्टॉलमेंट सक्सेसफुल एविडेंस होगा उसके आधार पर अगर सही तरीके से हो जाता है तो उसको हमने 1 लाख रुपए की राशि प्रेग्नेंट लेडी के लिए रखी। इन्हीं चीजों की बदौलत मैडम हमने स्टेट राजस्थान स्टेट में कुल 166 डिकॉय ऑपरेशन किए। 166 इज ए बहुत अच्छा फिगर है। पूरे राजस्थान स्टेट है जो पूरे देश में इस मामले में नंबर 1 पर चल रहा है, और इस 166 के अंदर हमने 46 डिकॉय ऑपरेशन ऐसे हैं जो हमने दूसरे राज्यों में जाकर के किए। जैसे हमारे जो बॉर्डरिंग स्टेट है, गुजरात है, हरियाणा है, पंजाब है, यूपी, दिल्ली, एमपी, इनमें जाकर के किए, और हमने इसमें कई सारी प्रॉब्लम भी फेसेस की थी। लेकिन इन सभी प्रॉब्लम्स को सामना करते हुए हमारे जो ऑफिसर्स हैं, जो काबिल ऑफिसर्स हैं, सक्षम ऑफिसर्स हैं, उन्हें अपने एफर्ट्स यूज किए, और इन एफर्ट्स के आधार पर ही हमने जो बॉर्डरिंग स्टेट के अंदर जाकर के समस्याओं का सामना करते हुए भी 46 इंटर स्टेट डिकॉय ऑपरेशन हमने कंडक्ट की मैडम। इसमें हमारे को कई ये चैलेंज भी फेस करने पड़े। सुप्रीम हाई कोर्ट के अंदर कई रिट्स भी लगी कि आप मतलब क्या है कि इस प्रकार से बॉर्डिंग एरिया में जाकर के कर नहीं सकते कार्रवाई, लेकिन माननीय न्यायालय जो हाईकोर्ट है राजस्थान, उन्होंने हमारे को 178 सीआरपीसी के अंतर्गत वेरीफाइड कर दिया कि आप 178 के जो ऑफेंस कंटिन्यूएशन ऑफ ऑफेंस है उसके अंतर्गत आप 178 में कार्रवाई कर सकते हो। जब हमने ये मैडम 166 डिकॉय ऑपरेशन किए हैं और इसमें 46 इंटर स्टेट डिकॉय ऑपरेशन किए हैं, इसमें हमने कुल एक बड़ा फिगर है 395 395 पर्सन हमने अरेस्ट किए हैं। यहाँ पर हमारे राजस्थान में एक पीसीपीएनडीटी ब्यूरो ऑफ इन्वेस्टिगेशन लाइक सीबीआई की तरह हमने पीसीपीएनडीटी ब्यूरो ऑफ इन्वेस्टिगेशन बना रखा है, जिसका जुरिस्डिक्शन है वो पूरे राजस्थान में है और राजस्थान में ये कार्रवाई करते हैं। इसके अंतर्गत हमने 395 लोगों को अभी तक अरेस्ट किया है। इस मुखबिर योजना के अंतर्गत अभी तक हमने 399 लोगों को 1,12,70,925 रुपए का पेमेंट भी किया है मैडम। ये जब से लॉन्च हुई 2011 से अब तक, जिसमें मुखबिर को हमने 147 लोग ऐसे हैं जो मुखबिर के रूप में 49,01,950 रुपए प्राप्त कर चुके हैं। इसी प्रकार से जो प्रेग्नेंट लेडी है वो 131 प्रेग्नेंट लेडी है जिनको हम 42,52,50 रुपए जारी कर चुके हैं। प्रेग्नेंट लेडी की हेल्प के लिए जो 121 हेल्पर हैं उनको भी हमने 21,16,925 रुपए जारी कर चुके हैं। इस प्रकार से ये एक बड़ा फिगर हमने मुखबिर योजना के तहत प्रदेश के लोगों को दिया है और जिससे हमें सेक्स जो रेशियो है उसको इंप्रूव करने में बहुत मदद मिली है। ये आप देखेंगे कंपेरेटिव स्टेटस ऑफ सेक्स रेशियो का जो नीचे हम आपको बता रहे हैं, चाइल्ड सेक्स रेशियो देखिए इंडिया में 945 है 1991 में और राजस्थान में 916। इसी प्रकार से सेंसस आप 2001 देखेंगे, इंडिया 1927 और राजस्थान में 909। सेंसस 2011 19 इंडिया में 888 राजस्थान में। अब आप इसको ऊपर वाली अगर इसको स्लाइड के ऊपर जो टेबल आप देख रहे हो, तो जब से स्कीम लॉन्च की है हमने 2011 सेंसस 2011 आया था 888, लेकिन 2011 के अंदर जो हमारा पीसीटीएस सॉफ्टवेयर है, प्रेगनेंसी चाइल्ड ट्रैकिंग सिस्टम, एक हमारा एनएचएम का स्टेट गवर्नमेंट का राजस्थान का एक बहुत अच्छा सॉफ्टवेयर है, जिसके अंतर्गत हम जो भी गवर्नमेंट इंस्टीट्यूशनल डिलीवरीज होती है, जो गवर्नमेंट इंस्टीट्यूशन है उसमें जो डिलीवरीज होती है प्रेग्नेंट लेडीज की, उसमें जो भी बच्चा जन्म लेता है उनका हम ट्रैकिंग रिकॉर्ड रखते हैं कि कौन सा बच्चा, कौन सी लेडी ने क्या बेबी डिलीवर किया, उसके आधार पर हम ये एनालिसिस निकाल करके ये डेटा निकालते हैं। तो मैडम अगर इस स्लाइड में आप ऊपर वाली इस कॉलम टेबल में देखेंगे तो 2011 में जब हमने ये स्कीम लॉन्च की तब ये फिगर 888 से 900 आ गया। लेकिन जिस दिन से हमने ये स्कीम लॉन्च की उसके बाद में आप गौर करेंगे 12-13 में 905, 13-14 में 924, 14-15 में 929, 15-16 में 929।
सॉरी टू इंटरप्ट यू, आपके पास एक और मिनट है।
यस प्लीज, मैं फिनिश करता हूँ। 938 इस प्रकार से आप कंटिन्यूस देखेंगे मैडम, 946, 947 और अभी रिसेंटली नवंबर 2022 तक में ये फिगर 947 आ रहा है। इस प्रकार से ये जो मुखबिर योजना है ये एक बड़ा माइलस्टोन है राजस्थान स्टेट के अंदर, जो क्या है कि सेक्स जो रेशियो है उसको इंप्रूव करने के लिए बहुत हेल्पफुल है। और स्टेट पीसीपीएनडीटी सेल और पूरा एनएचएम डिपार्टमेंट हेल्थ राजस्थान का इस योजना के मार्फत पूरे एफर्ट्स यूज कर रहा है और ये इतना अच्छा इनिशिएटिव है कि इस स्कीम के तहत राजस्थान बिल्कुल इस देश में अग्रणी पायदान पर रहेगा। थैंक यू सो मच। आपका कोई आंसर क्वेश्चन है तो प्लीज मैम।
नहीं, इसमें ये तो ओपन एंड शट केस है, यू हैव डन एक्सट्रीमली वेल। आपने 947 कर दिया जो कि नेशनल एवरेज से भी ज्यादा है। आई थिंक this is something really encouraging and commendable. So I have
thank you so much. अगर 947 में भी अगर मान लो मैम, मेरी रिक्वेस्ट है कि 947 में भी अगर थोड़ा बहुत डेटा अगर अर्बन एरियाज का और होम डिलीवरी अगर रह जाए तो अभी ये 940 से नीचे जाने की उम्मीद नहीं है मैडम। अगर सेंसस 2021 होता है तो भी एक अच्छा मैजिकल नंबर है जो राजस्थान
तो
स्टेट के पास है।
इंडिया एवरेज के साथ ही रहेगा अगर ज्यादा ना हो तो। And it's
बिल्कुल
quite
मैडम,
it's a big achievement. Very good.
Thank you so much मैडम, thank you so much. Any question please?
Surendra sir, we do not have Surendra sir with us. I think we lost him. Thank you sir for this project.
Thank you.